All right, we will begin our conversation. Let me give you the topics for today's discussion. Coronavirus pandemic, the case count rises to 287. We'll be talking also about health professionals as they renew call for more PPEs. And then the deputy ministerial reshuffle. We have Dr. Oko-Boye being named Deputy Health Minister designate. What impact is this going to have once he's vetted and confirmed for the substantial position on the fight for against the COVID-19? So I have my guest seated in studio. I have Ignatius Terence Nubeng. Did I get that right? And he is a Director of Advocacy and Research at the Africa Center for Health Policy. Welcome. How are you doing?
I'm doing very well. How are you too?
I'm good. Under the circumstances.
Oh,
yeah.
I can understand.
How was, just a quick 30 seconds, how has the lockdown experience been for you?
Well, I think it's been pretty exciting for me.
Mm-hmm.
Personally, I have not really been locked down.
Okay. You're part of the exempt group?
Yes, okay. Kind of. And I've also been assisting with the contact tracing in one of the municipalities as well. So, yeah, so I have not really been locked down.
I see. Exciting. I can see why it's exciting. All right. Okay, my other guest is Frederick Ewusi. He's the PRO of the Union of Professional Nurses and Midwives. Good morning.
Good morning.
How are you doing?
By the grace of God, I'm fine. And you?
I'm very well, thank you. And how have you been generally?
We are going. And as a nurse, I need not to stay at home, and we keep going and coming. Just that the lockdown has really affected our movements, and those that are not having vehicle. But I think there's a call for that and has been resolved. And we thank those who did that marvelous work.
Yeah. So far, the buses that are on the road what are you getting from your nurses and midwives? Are they experiencing more comfort and now as far as the transportation is concerned?
I think today is the first day that that initiative has been started, and we haven't gone on ground to find out the difficulties they are facing as at now. But I'm pretty sure by the midday we would get feedback from them as to whether they were able to
get on the buses.
Yes.
I actually saw a couple this morning, and I saw some nurses in them. So hopefully,
for University of Ghana Medical Center, the Nurses and Midwifery Councils offered their 2 buses for the university, and we are grateful for that. They started somewhere last Sunday, so they have really started ahead than their yellow buses.
Okay. All right, super. Let me just quickly begin by reading some stories to you, and then we will begin the conversation. The case count has risen to 287. Let me read that story for you on citinewsroom.com. COVID-19 cases in Ghana rise to 287. The total number of coronavirus cases in Ghana has increased to 287. This means that 73 more cases have been added to the country's case count as at 6th April 2020 at 11:30 p.m. Total deaths and recovery remain at 5 and 3 respectively. The rise in the number of cases follows the measures of enhanced contact tracing and testing, the Ghana Health Service said. Details of the latest additions were, however, not given. So far, Greater Accra region has most cases, that is 258, followed by the Ashanti region with 18 cases, Northern region with 10, Upper West region with 1, Eastern with 1, and Upper East region with 1. The period for mandatory quarantine for travelers who traveled between 21st and 22nd of March 2020, as per the President's directive, has also ended. This was part of enhanced measures to track the real numbers of persons who had contracted the infection in a bid to prevent a further spread. In all, a total of 1,030 travelers were quarantined within the period. But the GHS says out of these, 79, that's 7.7%, were positive during the initial testing, whilst 951 were negative. 26 among those that were initially negative were found to have converted to be positive at the exit screening, bringing the total number to a total of 105, which constitutes 10.2% among the travelers that were quarantined. Meanwhile, President Nana Akufo-Addo has said that has been vindicated by the decision to mandatorily quarantine all persons who arrived on the country after March 21st. He said the fact that the majority of Ghana's coronavirus COVID-19 case count is from the population of people under mandatory quarantine shows that the decision was appropriate and in the best interest of the populace. All right, let me start with you, Ignatius. So far, 287. It's a massive jump from 214. Cause for worry, or maybe hidden in there is hope?
Okay, so good morning to all our viewers out there. So from a purely public health and epidemiological point of view, I think this is to be expected, because when you move into an active kind of surveillance, as we are doing now, we are doing more of active surveillance for the disease now. And once you move into that area, you should expect an increase in the case, because now you are actively searching for those cases by trying to look for the contact of all persons who may have been tested positive.
Yeah.
So it is to be expected that, and I think by the time we are done with the various laboratory investigations for the rest, the numbers will still increase. So from the point from where I sit, that is from the public health perspective, I think it is to be expected, and it doesn't call, for so much worry if we actually adhere to all the guidelines and the protocol that has been laid down for us. I don't think we should be worried at all.
Okay.
Yeah.
Okay. Let me find out from Frederick. What is your take on this?
Yeah. Good morning once again, and good morning to your viewers. I think the jump, I saw it yesterday, and I was worried in such a way that we haven't experienced such huge number as we saw this morning. That is 83 in addition.
I think it's 79.
73 in addition, of which it's I think quite scary. But because when the president was speaking, he made us aware. He at least gave us a kind of assurance that we should be expecting this. And as my brother said, there are protocols laid for us to, I think, follow. We are expecting those numbers. As and when we had done so many contact tracing, a lot of number has come up, and we are expecting that at least some percentage of those numbers would test positive. All that we are saying is we are assuring the general public not to be panicking that much, that everything is under control. In our perspective, we are ready to work as a nurse, and I think with the help from the government, we would do our best. Even though the numbers are scary to some extent, myself, I'm not exempting myself from it. When I heard the number, I was panicking. But the protocols are there. Let's follow the protocols, and I think we'll be able to overcome this pandemic.
Okay. Now, talking about the protocols, I've noticed that as time wears on, more and more people are coming back into town, especially in the mornings. I see that a lot. This morning, I actually passed by a place where there's usually a market, and the market had started, with people just, crowding together and completely oblivious. Nobody's wearing face masks. They're all hanging out there. I'm not sure if this is going to help at all. I mean, I think it's going against the whole fight. Yeah,
it's very worrying, because the president mentioned partial lockdown, and in our definition it's partial, and so our movement, even though it's limited to some extent, certain things are exempted. Like you can go to the market and get some groceries and other things. And people are taking advantage of this and moving out for their. But when I was coming, I saw those who built the building constructors, the local ones. They were with their tools going out to work, of which it's not the best. I think the market women, they should restrict some of their movement, because when you ask them, they will tell you, we are not exempted, we are market women, and so we can go out and sell, and people will have to come and buy. And I'm sensing a total lockdown. This is what last time I came here, we were advocating for a total lockdown for us to critically contain the infection. We have seen an escalation. The number has increased.
Yeah.
And so our cry should be heard, so that this thing wouldn't escalate as it has escalated in different countries. If we go by this partial lockdown for quite a longer time, I'm not sure we would move to where we are thinking we can move the nation concerning this pandemic. I think the military, the security personnel should, beef up. They are doing their best, but they should beef up with the market women. They should, in my perspective, I think they should restrict their movement and ensure that the face mask, the hand sanitizer, the hand washing, because you go to some markets, they don't have the vertical buckets. They don't wash their hand. They keep selling. They keep exchanging money. This format a way of transmitting of the infection. So I think we should enforce more and stringent measures to keep this onward transmission of this infection. Okay.
Let me come back to you, Ignatius. From a public health perspective, is it time for a total lockdown? Juxtapose that vis-a-vis maintaining the current lockdown, but being more stringent on the enforcement of the protocols of this particular partial lockdown.
Okay, so the calls for a total lockdown, I would say, are not out of place. However, we should be mindful of some other factors, because if there's supposed to be a total lockdown, you should ensure that all the essentials that people would need are provided for them in their homes. And I don't think the nation is that ready to provide, and it may lead to a whole lot of issues. I know they are trying to, take care of the vulnerable and all vulnerable groups and all that, but to what extent? Because people would also run out of groceries and all that, and we want to come out. So we have to consider it in its entirety. I don't really support the calls for a total lockdown at this time. I believe that even with this partial lockdown, we are making headway. I have been on the ground myself with the contact tracing, so we are making headway. However, I believe if people are to adhere, the main issue now is with the movement of people into the places which have not been locked down.
Okay.
So we have to ensure for the markets. It's so worrying that people go to the markets. They are crowded. Suggesting that over the weekend, one of the markets had to be closed down and all that.
Yeah.
That is very worrying. That is the worrying situation. But going for total lockdown in this current dispensation, for me, I would tread cautiously.
Really?
Yeah.
Okay. Well, I think that it's good hearing that from you, being on the ground,
Sure.
and having experienced the contact tracing practically yourself and all of that. Let's go to the next part of the conversation. The health professionals have renewed calls for more PPEs. And let me read a story quickly for us, and then we can have the conversation about that. Provide PPEs for Laboratory Scientists Association to health facilities. Okay. The story here on citynewsroom.com says, the Ghana Association of Medical Lab Scientists has emphasized the need for various health facilities to provide enough personal protective equipment, PPE, for laboratory scientists amid an outbreak of COVID-19 in Ghana. The association has also cautioned laboratory scientists across the country to take the necessary steps to avoid being infected with the disease. GAMLS reiterates that the employer and managers of our health facilities must ensure adequate provision of the required PPEs in line with the Labour Act 2003, Act 651, and Act 1181 and 3 to enable medical lab professionals to offer their services routinely to patients and for the management of COVID-19 cases in our various places of work. It's important that the laboratory scientists who collect, package, transport, and analyze samples in various units of the laboratories across the country take every sample they encounter as a suspected positive sample for COVID-19, irrespective of the tests being requested. They are also advised to take the necessary precaution to prevent possible infection. There is the need, therefore, to identify precautionary needs and strictly adhere to them. Their call comes a day after the government indicated that it will, from Tuesday, begin the local production of PPEs in the country. All right, so, Frederick, I know that not this one, the medical lab scientists are calling for it, but I know that it's been a general call for PPEs for all health professionals, let alone just the frontline people, but everyone who is a health professional. Do you think enough is being done so far, as your association is concerned?
Yeah, I think concerning the PPEs, the authorities have at least have some for, almost all those affected regions. And it's not enough in my perspective, and we need more, because a whole America were in short of PPEs. We are also a sovereign country. We have cases are jumping, and so we need more PPEs. The call from the association, the lab technicians, is a call in the right direction, because if they don't have the adequate PPEs, and they are the first people or the first professional who take samples for laboratory investigation, and they are not getting the right PPEs, I think the government should provide more. And when it comes to local manufacturing, when is it going to start?
Is it today?
Today?
Yeah.
Okay, let's hope we get it today. But we also heard from the Citi news that ECOWAS has provided some PPEs for member countries. And yesterday we also heard on the news that Jack Ma has brought another set of PPEs to the country, of which people are having some issues with that. Chinese PPEs are contaminated. It's a perception that they are having. I don't know. I'm not an expertise to go into it. But we have had some from donors, from ECOWAS, and I think if those things are there, this is an emergency. We need not to wait for distribution. It should be distributed as early as possible for us to make use of them. Because if this thing doesn't get close to me, I came and I told our people that if you don't have PPE, don't dare attend to any patient. Because I work at emergency, and every case that comes to the emergency department is a suspected COVID-19 case. And so if you don't have the right PPE at that particular moment, you have every right not to work. You can't use your bare hand. You can't go to the patient without covering your nose, your mouth, and say you are going to save life. Yes, we have that kind of, love in us to save life, no matter what the situation is. But at this juncture, we are quite optimistic and quite, let me say, choosy in treating cases. Because if you are not careful and you get yourself infected, it is you and your God. So we are also supporting them that government should provide enough and adequate PPEs for.
Let me ask you though, Frederick. Since the beginning of the fight, I think it was 12th of March that we had our first cases. Have you seen visibly an increase in the number of PPEs available, generally speaking, to health workers?
No. In my department, we can't bring all the PPEs we have stores that we keep them. So we bring them in quantities. Then we take up the one that they brought. Any nurse that is coming will have to take up and hand over those that are left. And we use them judiciously, not to waste them. That is what I've seen in my hospital. But we hear on papers this number of PPEs has been procured.
Yeah.
This number of PPEs have been distributed. Yet nurses are complaining. Nurses, Kolebu of all were complaining that if there's no PPE, they are not going to work.
Yeah.
And so it's very heartbreaking. Let's see them. At this time, we should make everything open. Let's make sure that PPEs are given to our health workers so that at least they will have confidence that I am going to the hospital, I'm going to don the right PPE to face this pandemic.
Okay, let me ask you something to give us a bit of clarity. You're a nurse. Now, when you say the PPE, so typically you're going in to treat a patient. It's an emergency case. The patient has come in, patient is injured, wounded, bleeding. Would you still suspect that as a possible COVID-19 case?
Every injury, accidents. Yeah. Now we classify accident cases, casualties, a coma, unconsciousness. All those cases are classified as COVID-19 suspected cases.
Okay, good. Now, so what sort of PPE would you require to treat a patient like that? If, assuming they are suspected that they may have it, what would you expect to have as PPE?
You know, we have steps. We have patients, we have health workers that go in contact with positive confirmed cases. We have nurses who are the OPD or pre-triage area to see to this patient who are voluntarily coming in because of one or two symptoms they are exhibiting.
Yeah.
In this scenario, you know, to put on the coverall.
Okay.
Case hasn't been confirmed. You get your face mask, your gloves.
Okay.
You make sure everything that you do, every procedure you do, either you wash your hand or you apply the alcohol-based sanitizer.
Yeah.
So at the emergency level, you get your apron, you get your face mask, you get your gum boot, you get your gloves. I think that one will do. But when you get to where the case has been confirmed and it has to, be taken care of by the front line, you have to make sure you are in all the PPEs from your head to your soul.
Okay, I'm going to have you describe that properly to us when we come back after the break. Okay, all right. So we're going to take a short break. Please don't go anywhere. We're having an interesting conversation. We'll be right back. All right, welcome back. And you've sent us so many messages. Keep the messages coming. The number for you, if you just joined us, is +233 550 585 832 is the WhatsApp line to send us on, and the hashtag is Breakfast Daily on all social media platforms. Let me read a few messages that have come in. This is from Citizen Francis. He says, President Kufuor is doing well on the fight against coronavirus in Ghana. His determination to surmount this deadly disease with directives and policies that are geared towards safeguarding the lives of Ghanaians make him quite unique. May God continue to bless His Excellency Nana Addo Dankwa Akufo-Addo. Please, you spoke of using the nose mask, but we had an information that the Chinese infused the virus into it and ship it down to Africa. So some of us are afraid to use the nose mask. So please, is that the information true or not? Because most Ghanaians okay, so since most Ghanaians know about this. This is Moses Kena from Dowenya. Thank you. Now, Moses, I'm going to have my panelists comment on this particular one when I finish reading their messages, okay? They are both health professionals, and I'll leave it to them. I have my own opinion, but I'm not going to let say my opinion here. All right, please, good morning. My name is Crispus Aya. I'm a refugee from Cameroon. We appreciate the measures taken by the government to end this pandemic. To tell you the truth, we're also going through a difficult time as refugees here. Thanks. Please, if you feel backbone pains, headache, and swollen eye, should I suspect something like COVID-19? This is Aboko Stephen. Now, Stephen, please, let's do this. During the health segment, which is going to come in a few minutes, Dr. Kelvin Owusu will be joining us to answer all health questions. Okay, so kindly, if we don't remember to read your question, please send it again during the health segment. We will take care of it. Dr. Kelvin will answer that question for you. Good morning to you all. I have not come into contact with any positive confirmed person with COVID-19, but for some days I've been experiencing some bitterness in my mouth, some on and off headaches, some sneezing, and a few coughs. I am unable to go to the hospital because my cards, etc., are in my office. The only places I have visited were the Texpo Market, but I'm always in nose mask, gloves, and use sanitizers. My worry is that I have called most of the lines given for COVID-19, and I've worked when these lines will ring and ring and ring till it ends, sometimes after 25 to 30 minutes. Okay, so I think basically what you're saying is that you've called the lines, nobody is answering. He says, I don't know what to do because now I'm indoor and practicing inhaling steam of boiled neem tree. Okay, what do I do? And if you want to have an evidence of the calls, I can call and record it for you. If the call is picked, you will know that the time it took for the call to be picked. This is Nanaya from Spinktest. I'm really sorry about your experience. We also have my health people to comment on this as well. COVID-19 is a killer disease. Ghanaians should stay home and break the spread of the coronavirus. We must abide by President Akufo-Addo's orders and stay at home to prevent getting infected. The aged and people with underlying health conditions are at risk of COVID-19. So please stay home. This is Yao from Taifa, Burkina. All right, a couple more messages here. Howard from Palestine says the government is doing its best and every one of us should do his or her part. This issue about 3 months free water bill. Some of the landlords are getting problems with their tenants, especially the compound houses who paid before fetching the water. Proper measures must be put in place to support the tenants to also benefit from it. We are not in normal times, so we should support each other to get out of this crisis. Okay, so there's one more here. Nana Kwame from Kwadaso says, God richly bless President Akufo-Addo for putting the Ghanaian interest ahead of any other interest in his decision-making in these trying times. All right. Now Ghanaians will enjoy free supply of water for 3 months. Frontline workers will get 50%, etc., etc. All right. So your reaction to, okay, so finish your submission first of all on the PPEs, and then we'll bring in some of these questions that people are asking.
So the PPEs, that is the personal protective equipment, is not, as I was saying, it goes into stages.
Yes, depending on how dangerous.
Where you are positioned to work. If you are the OPD or the pre-triage area, you don't need the coverall, the one that you wear and covers every part of your body.
Okay.
You get your scrap. We wear scrap. You get your scrap.
What's the scrap?
It's an indoor wear for health workers.
Okay.
You don't send it out.
Okay.
We have the uniform that you go out with, but the scrap is an indoor. So you wear it in the facility. Okay. And even within the facility,
so it's a suit. It's like a gown.
Yes.
Okay.
Let me put it that way.
It's a gown.
Let me put it that way. So you get those ones. You get your face mask, being it the other types, N95. The N95, the surgical. Yeah. But we are also pleading that we should get the N95 because it has some, percentage of protection as compared to the surgical face mask. So if we get the N95,
this is a surgical, right?
This is the surgical face mask, and we have the N95, which is very potent. Let me put it that way. So you get that one. You get your gloves, your examination gloves. That one would also protect you from getting the infection. When you are even taking temperatures of suspected cases, is not necessarily facing the person. You can stand at the lateral part of the person, take it at the side of the neck, or even a person can bring the hand just here. You can also take the temperature, of which it will prevent you from direct. I mean, if the person coughs, you can face it directly. But afterwards, if the case is being confirmed from the laboratory and is confirmed as a positive case, we have protocols of, sending this case or managing this case. And this is where you don the proper PPE. All the PPEs. Covers your entire body.
Everywhere, including the eyes?
You wear the goggles, so the eyes is also protected. Yeah, the soul is protected. Every part of your body is not showing. It's not coming into contact with external environment. And so you are safe to take care of that person. The patient who is confirmed will put on the mask. You also put on all your apparatus and make sure you work to save yourself or giving any sending infection from this patient to another patient.
Okay, super. Your comments on yes, on the PPEs and the call for more PPEs in the system and all that.
Okay, so in the first place, I would like to commend corporate Ghana, private individuals, and even the government for the efforts they are putting into getting more PPEs, because it's a consumable. You use, you have to discard. You use, you have to discard. So but the calls for the PPEs is very genuine. I would even talk a little bit from the laboratory point of view.
Sure.
Because the laboratory in every health setting is one of the most important components when it comes to diagnosis. Because without the laboratory diagnosis, the doctor cannot tell you have this condition or otherwise.
Okay.
So it is very, very important. And when it comes to their work, there has been some research, though they have been rebutted, but then there have been research that suggests that there is a tendency or the likelihood of spread through the aerosol under certain conditions of pressure. Okay, it can. But then when you look at the setting of the lab as well.
When you say aerosol, what do you mean, so that our viewers can have a sense of?
Okay, so aerosol can be something that can be
droplets in the air.
Droplets that can be found in the air. You can, those are all aerosols.
Okay.
Yes. So under those conditions, it means that some research are saying that it can be transmitted under those conditions. But then others are also rebutting. So far we have not been able to find. But then it is better to be safe.
No, but I believe in the aerosol concept, because that's how.
Sure.
How else does asymptomatic transfer happen?
So that can be in so many forms. It can be in so many forms, which I don't think we can go to now. But then, from the laboratory point of, I think the call was made by the laboratory persons.
Yes.
And I feel right from the phlebotomy area where they pick the samples of the patients, they are exposed. Okay, and then even when the sample gets into the lab itself, they use the centrifuge to spin the sample. After they have spinned it, they will pour it into other gadgets and containers to ensure that things are done. And through that, you have subjected the sample, if it is true, what the research is saying is true, and it can be transferred to the aerosol transmission. Then it means that when they are in that process of spinning and all that, they can be exposed.
Also being exposed.
So I think, if we are looking at providing PPE, it should be provided across board for every person in the cascade of the healthcare profession. So it is very necessary that we really take this into consideration. But then I would also like to comment about, we have this, it's been on the drawing board for a very long while, the laboratory policy, the policy for the lab.
Okay.
And I feel if we start implementing some of these things, all the protocol regarding infection prevention and control for the lab and everything, they have been all spelled out on the laboratory protocol that are still on. This yet to be launched. Anyway, it's been there for a while, developed by WHO together with some biomedical laboratory scientists in the world, consultants. And I believe we should actually put in more efforts, ensure that this issue is resolved. Yeah.
Okay. Now,
I want to
go ahead.
When it comes to this infection prevention and control, we sometimes omit the OLIs.
Sure.
Yeah.
And I think at the end of everything, they are the one who discards all these PPEs, used PPEs. And yes, they are parts, but how are they taking them into consideration? Because in some situations, we talk about only nurses, only doctors, midwives, and the laboratory scientists. But we usually forget about these onlys.
Yeah.
They do the dirtiest
the janitorial work.
Yes.
Yeah.
And I think they should be given the right tools to work with. This time around, we shouldn't, means on things, because they can also spread it well. They are the latter parts, let me say, the dirtiest parts of it, or the channel. So they should be given the right PPEs to work with. They have their different type of PPEs. Even decontamination, you have to don the proper PPEs when you are decontaminating all those things. But here in some hospitals, we see it. One utility glove will be used for this procedure, that procedure.
Yeah.
And I think all this only should be given an in-service training to be well abreast with issues concerning this COVID-19 and its spreads.
Okay. Just quickly touch on this for me. One of the viewers said, please, you spoke of using the nose mask, but we have information that the Chinese infuse the virus into it and ship it down to Africa. So some of us are afraid. Moses is saying this from Dovenia.
Mr. Moses, we don't have any evidence, as in, I think Food and Drugs Authority, Ghana Standard Authority are the best people to come out with information concerning this perception. I am not aware, or I am not aware whether it is true or it's not true, but Standard Authority would definitely test the efficacy of this, the potency of this
before they release it into the system.
Yeah, definitely. They can't just, because we are in need of it, as soon as it comes, we just take it to the health service. Oh, use it. We got one from here. We got one from, so use it. Definitely, they are going to make sure they scrutinize it, see whether what people are saying is the actual situation or not.
Is that what you expect them to do, or that's what you know they will do for a fact?
That is what I know, and that's what I will even expect, and they should do more. That's their job. They should make sure anything that comes to the country are of high quality and standard. And how do you measure that? When they have, pass it through their protocols to know that it really fits what we are using it for. Definitely they are going to do it.
What are your thoughts?
Yes, and for the PP, and then this Chinese issue, I think we should tread cautiously. not because I'm scared, but what I mean is, there is no evidence as it stands to suggest that they are contaminated. That is why we also have our own protocol in country, which we are supposed to follow. For instance, as he mentioned, the Ghana Standards Authority, they are supposed to ensure that every single item that is brought for use are actually tested so that it meets the required standards in the country. So I think that is what even accounts for the delay sometimes in disbursing some of these PPE and some of these equipment to the various facilities, because they have to be necessarily tested, to ensure that they adhere to the standards. But as to whether it is done, I sitting here cannot vouch for it, whether it is done or not. But it is the expected outcome that is supposed to be done.
I'm going to put the two of you on the spot. You walk into your facility, PPEs are handed over to you. Do you question where it's coming from, or you just use? It doesn't matter.
In most instances, you would not question where it is coming from, because in your facility, though, sometimes health workers work under extreme pressure, conditions of pressure. Are you going to, at that moment when there's a patient, that you have to attend to, then you're going to ask, where is this coming from? You just have to trust the system. That's whoever along the value chain, where it's supposed to come from, the supply chain, coming down to you, the final consumer of the PPE, that the person who is actually bringing it to you has ensured that they've done their job well. So it is not for it's good that we can try, but then it is not for the end user to actually verify.
Yeah. Okay. Right. Fantastic. Let me read the final topic to us. We'll get into it. So we want to discuss the deputy ministerial reshuffle. Is it going to benefit the fight? Let me just say that I have personally over time gotten to really like this gentleman. but I don't know him as personally, but I really like his approach, his mindset, and the way he works. The story here says, this is on citinewsroom.com. President Nana Addo Dankwa Akufo-Addo has named Member of Parliament for Lejokuku Bernard Oko-Boye as Deputy Minister of Health designate. If approved by Parliament, Dr. Oko-Boye will take over from Alex Kojo Kom-Aban, MP for Gomor West and currently Deputy Minister for Health. Mr. Aban has also been moved to serve as Deputy Minister for Communications and takes over from Vincent Sowa Odotsai, whose appointment as Deputy Minister for Communications has been revoked by the President. The new appointments, according to the statement, will take immediate effect. The President Akufo-Addo is hopeful that Parliament will expedite the vetting of the Deputy Minister designate for Health so he can assume his office quickly as possible. All right, so let me just quickly ask your thoughts on the impact of his appointment.
Yes, I think Mr. Honorable Oko-Boye is a gentleman and is on the field. When it comes to health, I'm not saying all those deputy ministers didn't do their best. Did their best. And we've been, as health workers, we've been crying for our own for a quite long time. And I think it's a call in the right direction. President have, heeded to some of our suggestions. We thank the president. The impact is that he knows what we want. He's a doctor. That's his profession. He knows what health professionals want. Again, I'm not saying those who are there don't know. Definitely they will read. They have advisors. They have people who have been there as civil servants who are there. And so they will learn all those things from them. But this man has been a board chair on the Kolebu and has the technical know-how when it comes to issues relating to health. And even when this pandemic came, we saw him very vibrant from radio station to TV stations talking about the pandemic, this issue. At this juncture, we need people of this nature. Even though the others have done their best, we need them to come on board to, bring their ideas to help fight this COVID-19. He's I think to me, I think he's the best person to do that job. I was even thinking become a substantive minister. I'm not campaigning for him, but that is my own. That is health, and that is I want. One day, I'm just praying that one day we'll have a nurse minister, a substantive minister from the health sector, from the lab.
But you know that the ministerial role is a managerial role.
Oh yeah, I get it.
So necessarily being a technical person,
but that gives you
an edge,
advantage.
Okay.
When it comes to decisions of that nature, that gives you advantage.
Okay.
I think that is my view.
Okay, no problem. What do you think?
So in the first place, I would like to say a very big congratulations to him. I think he's a physician. He had some background in public health. He's on the health committee of Parliament. He's the board chairman for. So in terms of health, he has the acumen to deliver. But then I also think the call for his appointment or his designation currently is good that he's been appointed, given that role to play in this crucial moment. But then it also brings to the fore an argument that we have been trying to push for all along, that there are some technical areas like education, like health, which though ministerial positions you don't necessarily have to be they have technical know-how in it before you can actually work. Because I know the current minister was brought in, he has an accounting background, but he was brought in for a purpose. And he said, but then well. He's doing very well. But it is always good to balance it, such that in those areas of our sector, you can have somebody who is from the technical point of view, though a politician from that angle, because we all know very well that decisions finally have to be made by the politician who is the leader at that time. And if he does not have that kind of sense of urgency to ensure that it is done, and they can rely on the bureaucrats, the directors and all that, the technical people there. But then we also need the technical people, if they have it from the political side. It's always good to merge them, such that we have a balance of technicality and then the political will, and then it moves. So I think it's a call in the right direction, though I think it came a little late, but it was always, better late than never. All right. So I would like to congratulate him as well for
fantastic.
And he's a very good friend of my boss as well, so I know I know him.
That's good. Today your messages are coming, with so much fervor. Let me just see if I can address as many of them as possible. There's a question for you here. It says, who is a frontliner?
Okay. This, let me say, have become, let me put it this way, a brouhaha for the health workers. Now, we are all, for me and the others, for Professional Nurse and Midwife Ghana, we believe and we know that upon meeting the minister, a frontliner is all the health workers working in the facility. Because when you talk about a frontliner, the one who's at the pre-triage area is at risk of contacting this disease. And so wouldn't be taken out when it comes to the management of a COVID-19 case. This nurse would only put on face mask, would only put on glove, take temperature. In a situation where you get, maybe, let me put it this way, a patient who is quite difficult and have planned to, spread the infection. We've seen it on social media, some people making an attempt to, spread the infection through lifts and other things, would remove the face mask and cough in the air. And whoever is around is at risk. And so those who are taking care of this patient when it's being, confirmed, and others are classified them as the frontline health workers. To me, I believe all the health workers who are at post at this crucial moment are frontline health workers. And so we this confusion of 50% addition, blah blah blah. The minister came, I think, yesterday to clarify issues and define who a frontline health worker is, and even went furthermore to say that they have code for those staff who come in contact with patients. I don't know how they did it, but yes, last Sunday I was at post at the designated area for COVID-19. If a case comes, I take care of the case. I used all the protocols to take care of the case. And so I am a frontliner. A colleague who's at the OPD is a frontliner. The one who is taking care of, that's why I say it's a step. It starts from 1, 2, 3, before it gets to a critical, before it gets to even the ICU. So if you don't send a case to the ICU, those nurses that has been trained to take care of, to do the intubation and all those things, would we classify them as a frontline health worker? The lab technician, the orderly, everyone who is putting his best, who is trying to make sure this COVID-19 has been really tamed, is a frontliner. And so if there's any package, I think the government should, come and, the government has given a definition, but we are also, speaking to the ministry that, but that's where we went, and that is their explanation that they're giving us.
All right, okay. Let me quickly go through some of your messages that you sent us. All right, so Evans from Ashaman says the receiver has not paid us our claims. If the president extends the lockdown, it will really worry us. Bonti Benjamin says people should know that this is not a time to entertain conspiracy theories on PPEs and other medical equipment that are needed to fight the deadly virus. Let's be calm and stay home. All right. Okay. Mark my words, quarantine is much too open. Last Sunday looked almost like a normal weekday in Accra. Police at barriers, not very alert, they just let everybody pass. Today we added over 70 new cases in Accra. Most amazing. No extra attention in the press. 19 extra cases of people in quarantine. After 2 weeks, that means internal spreading because quarantine has not been strict enough, or staff have been infected and spread it to others in quarantine. We need to be more serious with our lockdown. Okay, another message is coming in. President's orders are much too lenient. I bet over 50 cases non-quarantine have infected already 150 others. Okay, I don't know how you come up with this, but okay. Good morning. Thanks for the wonderful work you're doing. I would advise that the citizenry should stay at home and leave the PPEs like face masks to the frontline workers and health workers. If not, pressure on the PPEs will not be managed well. Okay, so hashtag Breakfast Daily. A couple more messages before we go. The president is doing much to help the country overcome this pandemic. We all also call on him to make more PPEs available to protect us, the health workers, as we lead this COVID-19 battle. Ghanaians should stay at home to help contain and curtail the spread. Citi News, you're the best. Okay, this is Teria Nash from UPNMG, Greater Accra. All right, thank you very much. Let me say thank you to Frederick Ewusi and to Ignatius Nubeng. They have been my guests this morning. Very, very wonderful guests, and we've had a great conversation this morning. I trust that you've enjoyed. Thank you so much for sending those messages. Absolutely fantastic. This show will not be what it is without you. We will be having the health segment shortly after this break, and we'll be talking to Dr. Kelvin Owusu. It's going to be a very fascinating conversation. Remember, the hashtag is Breakfast Daily. Send in your questions, anything, not only COVID-19, anything health that you're experiencing. He will answer them for you. Let's take a short break. We'll be right back.